the mental emotional aspect. We know that if you're just treating the physical aspect and you're not treating both, your success rate is going to be less than 10%. So you have to treat the whole picture, and that's why having a multidisciplinary approach is really important. And I have, if I don't have people within my office, I have a lot of people outside my office I use, which I think we're going to talk about with some of the other questions. But I think the first question is just what is the pain experience for you? And that's kind of like, that's how I first address it with my patients.
Thank you. So that leads us into our next question really well. How does your treatment approach to pain differ in acute versus chronic? Dr. Black, if you want to just...
So how my patients, how this differs is that with my acute patients, I have a certain type of protocol where I do treatments. I do a lot of neural therapy, and I can kind of talk to you about that later as far as what that means. But it works on the peripheral nervous system as well as the central nervous system, and we work on diet. I expect an acute pain patient to start receiving relief within about 4 weeks. That's just what I've found. You're going to have ups and downs, but you should be able to see relief at some level that's consistent with acute pain. My chronic pain patients, I usually tell them, if somebody's coming in and they've said, I don't remember the last time that I felt well. That's the first question I always ask, like, okay, when do you remember not being in pain? When do you remember just feeling like a normal individual? And if they really can't tell me that, I mean, you have to give them a realistic goal where it's like, it's going to be a few years of us working on you. Not saying that you're going to be suffering as much as you're suffering, but it's going to take time. And this process is going to be ups and downs, and we're going to have a honeymoon phase, and then you're going to have aggravations, but it's going to be a process. So that's kind of how I explain it.
Thank you. Dr. Newman?
Well, actually, my view, chronic person is an acute person that just never got fixed. That's all. Just somebody never got figured out, and the problem persisted, and so that you're going to find the same elements. The pain industry, is a massive industry, right? There's body work, massage therapy, there's physical therapy, there's drugs, they're dealing with scoliosis, they're dealing with spasm, they're dealing with muscle problems, all these things. But all of these began somewhere. All of these are secondary phenomena that began, and the idea is to get to the original, so to speak, point in the pathway. And if we don't do that, both acute patients and chronic patients are not going to get very far, or not as quickly. So in our practice, every visit we assess the connective tissue component, meaning tendons, muscles, discs, as well as discs and ligaments. We address the osseous component, which means the vertebra, the bones and so forth, and we address the neurologic component. And when you do that, when you do it appropriately, things get a lot simpler. It's not to say that people don't need every other kind of management, but my emphasis and focus is to let's think not management, because that accepts the reality of the condition. Let's think of correction. Let's think of resolving it for good. So that's what we try to do. And so if we can get the proper analysis, it's all about the right diagnosis, then things will get a lot simpler. And I don't find chronic cases are any much more difficult than acute, by the way. Particularly if someone's been in a bad car wreck or something like that, those can be murders.
Good. Dr. Cooper?
So I have a basic different approach to each, the acute and the chronic. With acute, usually I can expect to see some changes and the patient getting better within about 2 or 3 treatments, really, with acupuncture and massage combined. And the difference is that I do a lot fewer needles locally, but I still do a lot of them distally. And one of the key parts, and I'm kind of echoing what you said over here, with pain you always treat the shen, which in Chinese medicine is the mind. So you always treat the shen, whether it's acute or chronic. With acute you definitely do a little bit more focus on the shen. And you're also working on, like you said, inflammation, where we're going to be doing a lot more work on relieving heat and getting heat to disperse. Whereas with chronic, I tend to use a lot more local needles and local work with the massage. I do local work with massage for the acute as well, but more local needling. And one of the key things is when you're working on pain, whether it's acute or chronic, you have to work along the meridians as well. The meridians, I'm sure all y'all know that basically they're like channels where the energy, where the chi flows. And you have to work distally on these meridians away from where the pain is in order for the chi to have some place to go. As far as how long it takes for the pain to get better with chronic, general rule of thumb that I use is it depends on how long the person's been having the pain. The longer the pain's been around, the more treatment it's going to take. And my general rule is that every year that they've had the pain is going to be about a month, month and a half of treatment. So 4 to 6 weeks of treatment and treating twice a week for that. I think that's about it.
Thank you.
From the pediatric psychology perspective, I think there are certainly some similarities between acute and chronic pain situations from the psychological side of things, in that we know that expectations matter and we know that your attention matters immensely. So with kids in the hospital, there's lots of situations where kids are going to be getting acute painful procedures, and a lot of how those get treated is helping reduce fear and reduce parents' fear as well, because parents have, there's a quote about parents and kids having like wireless broadband emotional communication that I kind of really love, that really if you have a parent who is worried and anxious or catastrophizing, one of my favorite words, the child picks up on that very, very easily. So in acute pain situations, it's a lot about helping set expectations in as positive a way as you can, and then giving kids tools in the moment to direct their attention elsewhere. And some of those same strategies are helpful in the situation of chronic pain. I think that one of the main ways that for me in my practice that chronic pain differs is that I find myself using a lot of analogies to help patients change their thinking about their pain. So thinking about ways that you can help them reconceptualize what those nerve signals might mean, and give them some sense that there's some hope that they may be able to exert some top-down control over their experience. So I think that's kind of the biggest difference.
Good, thank you.
Can I interject just real quick?
Absolutely.
I think having a psychologist or behavioral therapist person involved in the process is extremely important for pain. Like, I've learned so much since I've done this over the last 6 months, and I just want to give kudos to everything you're doing, and like it's awesome. Because I think there's certain ways that you can approach these issues, and there's so much trauma that comes with a person that has pain, psychologically, them living with it, and then trauma that maybe they really didn't understand that, me as being an HPAThic physician, I'm trained a little bit more, I think, than maybe a conventional doctor, but still not enough. And so you need help. And so I think, exactly what I think you just kind of hit it on the head. I think there's a lot of like different aspects as far as like how you approach it with how they interpret their pain and affirmations that you need to really kind of work on, because you're not really going to get to the cause unless you do that, however you do that.
Good, thank you. So again, that leads me to, at what point do you refer out in your practice? What do you find are the limitations of your scope of practice, and maybe some specific conditions that you know that you tend to co-treat with more often? Dr. Newman, if you want to start.
I like to have a pretty tight standard, so I like in an acute case, if it's a disc, let's say, a lumbar disc, and a person's really not enjoying life that much, we like to see something to change within a week to 10 days. If it's not better than a week to 10 days, then we want some other information. I'm not interested in having somebody stay around if they're not getting the best results, and so that's a standard approach. Is this where you want to talk about the comorbidities too?
Yeah, I
Is
have
that
that
a
as a,
different
as a
question?
separate question, but this
Oh, okay,
just
well,
being
I can
more,
wait.
more focused on your scope of practice. So either a timeline or a condition where you're saying
Right,
when this
right.
happens, you're referred to
So I
this
think we have a
practitioner.
plenty busy, I think Dr. Wilson has a really interesting, I don't know exactly the kinds of pain, I don't think you mentioned the types of pain you're dealing with, but it seems like it's
So we
pretty
see,
engaging there.
it's pretty diverse. So we see a lot of kids where the majority, if you had to pick a pain clinic day, you'd be seeing 14 to 15-year-old girls with abdominal pain, musculoskeletal pain, and
Awesome,
headache.
okay.
Yeah.
It's not like,
So-
it's not like critically ill.
No,
cancer
we
pain.
have a portion of our kids who are critically ill or post-cancer treatment, but that's not the majority of who we're seeing.
We should talk here about, by the way, one of the questions I fed back to you folks was trying to create, it's a simple concept, but sometimes I ask my patients, what does pain mean? You know, what is pain? And it's like I said, it's a simple answer. What does pain mean? Who would like to tell? What is pain? See what I said? Nobody knows. I mean, nobody's confident. So pain means something's wrong, obviously, right? But actually, more than that, something is calling for correction. And so 80% actually of most pain syndromes, at least my experience, is not diagnosable. They're not, most symptoms, human symptoms in pain don't have a medical diagnosis. There's not anything the medical doctors, they can treat it, but they're not going to be able to make a real significant change in it. 20%, I don't know if you all have a different opinion. Yeah, you're breaking down, you need to go to the hospital, you need to be on drugs, you need some major intervention. No, 80% of complaints is that the body's saying, I need something, I need a correction. And so that's the way we look at it. And one thing that, where I don't want to be dependent on anything. And